nationwide health assessment designed to strengthen HIV services, expand access to testing, and improve the overall health of communities. Now, trained field workers carrying official ID cards and AIS kits will visit selected households in all 20 local government areas, giving residents a safe and confidential way to know their HIV status at home. Joining us for this conversation is Lagos State AIDS Program Coordinator, Dr. Oladipupo Fisher. Good morning, Mr. Fisher. We're eating a lot of fish on the show this morning, right? Good morning. How are you doing? It's a pleasure to have you on. This is a very fantastic topic, and I'm happy that, Lagos State is coming out with this very, I would say amazing initiative. Oftentimes, people do not want to go to hospital, to test, because they tell you that if I go and it's positive, then the people know me. For me, that's been a conversation. People always tell me that, Ria, I don't want to go. What about if it's positive? And that has hindered a lot of people from even checking if they have HIV or not, which is very bad, because we know that with HIV, if you're able to detect it fast, it would not get to the state where you are now in serious problem. So this is a beautiful initiative, but I want you to quickly take us through this ART. Who brought about it, how long is it going to last, and how impactful do you think it's going to be? But most importantly, I need you to explain it to the layman that doesn't even understand what it's about. Okay, thank you for having me. I want to start from the first point you raised concerning the testing, why we have hepatitis towards HIV testing. The honest truth is the fact that there is confidentiality in the testing. When you go to the vaccine, you and the trained counselor testers that are providing these services. And then, of course, when the result is to be shared with you, and then, unlike in the past, when someone tested positive for HIV, that's assumed to be a death sentence, it can be managed. So, the earlier is detected, before you get to the advanced stage of AIDS, the person can be initiated on treatment and then, of course, live a productive and meaningful life. Like any other person. So, having said that, concerning the anti-retroviral impact survey that the state is conducting right now, it's very, very important that we actually have this done to inform policy, program planning, and then, of course, to improve the health outcome. A lot of resources in terms of financial and human resources have been put into HIV and AIDS response, and this is based on evidence, data, and in order to review the impact of what we've achieved in the past and currently where we are, and if there's a need to change strategies, there's a need to conduct survey. The last survey was conducted in 2018, the Nigerian Impact and survey, that put the HIV prevalence in the state at 1.4. And then that's about 7 years plus now. There's a need to look at what we've achieved. And more importantly, the world is looking at attaining global eradication of new infections of HIV by the year 2030, which the country has signed on to. So we need to look in this direction. Are we achieving the results, the 95-95 targets? Is there any need to address the strategy we are using, or we are on course? So this impact survey will reveal this to us, and so this will help us even to get efficiency of the limited resources that is available for HIV response. So it's very, very important that we have the support of the community, the household that have been enlisted to participate in this survey, so that we can get the right outcome to help to inform programming.
This survey actually promises high resolution insight, but I'm concerned about the inherent methodology challenges, talking about potential misclassification in testing, simple bias, or logistical hurdles. And all this could probably compromise, data accuracy. So what do you think we can actually do to guard against this in policy decisions or formulations, and validate and also triangulate findings, from the survey against health, other health data?
So I will start from this survey. The methodology for this survey is a household-based survey. It's a cross-sectional survey, and then it's been scientific about the whole process. The methodology is a random sampling method is adopted. We have 205 enumeration areas across the state, and then we're looking at in each of the 205 enumeration areas, we have 30 households per enumeration area, which makes a total of 6,150 households across the state. Irrespective of the number of people in each household, the survey will
they will be involved based on the criteria, inclusion criteria, 15 to 64 years. Anybody that sleeps in that household overnight are included in the survey. So that's actually try to include everybody that is needed to be part of it and putting science into place in terms of random sampling. And then beyond that itself, we've created awareness, looking at different structures for people in the area of bias. We know the perception of people towards that. Do mobilization, sensitize the community leaders, sensitize the religious leaders, and the youth leaders around that area, in order to build trust towards the survey, because a lot of trust versus mistrust are out there that can actually increase the rate of refusal. The rate of refusal will actually affect the outcome, which we're actually working on. We've started the community mobilization way ahead before we commence the process for the survey itself. So the outcome, we are confident and comfortable with the level of acceptance and the little rejection we are having currently. We can't rule that out.
The rejection is coming from where?
Yeah, definitely.
From wrong biases, people are having a good example facing some of their in one community. People are one household, anyway, not even the whole community, one household. One of the respondents, having conducted hers, giving the impression that the survey is bringing about the 66 mark.
Oh, conspiracy theory.
So you understand. So we had to go back to sensitize people, and then of course, and the survey don't force people to participate.
Of course. But let's talk about this. We're looking at 20 local government, areas as well. I want to know, if the person does the test and is positive, what next? Because we also have to speak about that. Sometimes people can do the test, is positive, they start praying to God because they don't even want to take it to the hospital to say that I've done it and it's positive. So these are things that we need to look at. We also need to educate them that if it's positive, this is what you have to do. What are you guys doing, with the ART about saying that if you are positive, this is the next place to go?
Fine. Thank you. Very, very brilliant question. So now, for the be it the community, even the survey, those who tested positive, because there are community outreaches for HIV, like you rightly said, some people will not walk into the facilities, despite the fact that the test is free.
Okay.
So, I mean, the health sector and then some private,
But are they doing the test in their houses, or they are coming?
There are two components. I'll address that. Because there is self-test kits which you can do in your home comfort of your own house or anywhere you have. And then there is a rapid test which you need a prick of blood, which is being done at the facility or the community level. At the first, so now, if anybody is tested, be it the self-test kit or the rapid test kit being conducted by cancer tester and tested positive, there are different options. That we have 105 facilities across the states that provide the ART services. The person will be referred, if it's a community outreach that the person is discovered, referred to the facility for retesting.
Okay.
So that will confirm that the person is truly positive before initiating the person.
So are you saying that is not so accurate? Why does the person need to go and do another? Please explain to us so that we understand.
It's quality control.
What about somebody saying that, or has it ever happened that the person will do the test, it will tell you positive, and you go to the hospital and to be negative?
Yeah, well, very rare, but it's possible. I mean, it's in medicine,
it's a possibility. Never say never. Yeah, it exists. So.
Okay. Do we still have that kind of proliferation? And number two, your partners on this survey, I know the United States government is part of it, and so maybe so many others which I'm not too sure. And that's why I want to find out. We need to know your partners to know how strong this survey is and how successful we expect it to be.
Okay, thank you for that. The first part of the question, you have a lot of NGOs that work in the space of HIV. They're still there providing support. For this survey, we are not going the route of NGOs. We're working, like you said, the CDC is funding this survey through the Federal Ministry of Health, the National HIV and STI Control Program. And then the implementing partner in this is the Public Health Information Solution and the Surveillance and Solution System, RISE-3, working with the Lagos State Ministry of Health, which where I came from. So for this, there is a scientific process. There is a protocol for the survey, which is strictly adhered to. And then, of course, the Federal Ministry of Health, the CDC themselves are monitoring this, and then we'll have the NREC, the institution, monitoring this process. So the standard for this, so that because the outcome of this survey will shape a lot of things, will help us to know whether the prevalence, we're achieving results, the value suppression, which is the most important thing, are we attaining the result? Is the program failing? Is the program achieving the result? And then, of course, that will help us to learn, unlearn, and relearn if there's a need to change strategies. So this is critical to us in Lagos in particular. And then, of course, because Lagos invariably represents larger percentage of the country. Absolutely. So if you get it right in Lagos, you probably get it right in every other.